Hospice Care Week 2020, this is what it takes. What does it take to provide truly holistic care to patients and their families? Well, what I've witnessed in the last 6 months is nothing short of truly inspiring. The resilience and the capability and the flexibility and the adaptability of all of our staff, not just our nursing and frontline staff, but also our catering team, our housekeeping team, all of our support services who've worked really hard to keep patients at the front and foremost of everything we do and everything we think about at Havens.
Yes, I'd agree with that. I think one of the notable things is how many people have just stepped up to the plate, and we've asked them to work in areas they've not usually worked in. We've asked them to fill in gaps. We've asked them to act up and act down in roles that aren't normal for them, and they've just done it, and done it really, really well. And with COVID around, it's been a pleasant surprise that we've had very little in the way of staff sickness. And I think that's beginning to take its toll now. We're seeing that as resilient as people have been for us for 8 months or so, people are now needing their breaks because they've really worked very, very hard to keep us running at a high level of activity during difficult times. So we need to be aware of the fact that we are human, and we need to make sure we look after ourselves as well as the care we provide for the people who need our services.
I think there's been a huge focus of team spirit across the organisation, and again, not just within the care services, across the whole organisation, in the sense that actually we all had to come together. The global pandemic forced us to all work together in a different way, and those are some of the things that we're definitely going to hold on to with the up and coming months. Obviously, winter's just around the corner, and we don't know whether we're going to be experiencing a second surge of COVID, so we are going to have to continue to work in this way, to work as a strong, dedicated team who are patient-focused, and really concentrate on our mission of delivering care free from barriers to as many people as we possibly can.
Yes, the amount of additional work that's been happening in the community has been quite dramatic. People have been quite afraid of being in hospitals, or even to some extent coming up to the hospice. So our hospice home team has been working flat out, and it's been great because they have been able to keep people safe and secure in their own homes when that's where they wanted to be. So I expect we'll see more of this, and I'm just hoping that we can continue to enhance what we're doing through our more outpatient-based work, the hub, which has had to backpedal during COVID because we've not been able to run outpatient services as we'd wished to. But I think there are ways and ingenious ways that we're looking at developing new services, which in some respects, the COVID problem has accelerated what we've always wanted to do, and it's brought out some real innovation amongst our teams, which is lovely.
One thing is certain at Havens Hospices is that we will always try to put the patient first and give anything a go. And we've seen some really capable ideas from some of our care staff in delivering care creatively during COVID. One of the most challenging things was the restricted visiting, so supporting people at end of life who didn't have access to their extended family was really quite challenging for staff. And in terms of this is what it takes is for people to keep going and to provide the best care that they can within the circumstances that they experience.
We've had people pick up iPads who've never picked up an iPad before to make sure families are kept connected, and it's been tough. It's really been tough because when you ask people, is this what you'd expect if you're working in a hospice, they say no, this isn't how we normally work. We want to keep families together, we want to deal with those relationships because that's what makes us who we are. And so that's been quite difficult, but as Ellie just said, the teams have risen to the challenge and dealt with frustrations from family members, dealt with sometimes a little bit of conflict, but dealt with it in a very positive and professional way, and managed to maintain those relationships and support people despite the unfortunate restrictions we've had to put on visiting, which has made us preferable to the hospital, where they had to be even more strict. But it doesn't feel like what the hospice was designed to deliver. And we can only hope that as the pandemic eases over the coming months and years, that we can return back to a more flexible way of working.